Fence, we talk about a recent summit held at UVM by the UVM Larner College of Medicine, the College of Nursing and Health Sciences, and the the University of Vermont Health Network to discuss health equity. Plainly stated, health equity is when everyone has a fair and just opportunity to attain their highest level of health care. Good afternoon and welcome to Across the Fence. I'm Jolie Whitney. It's undeniable that health disparities and inequities exist within our local and global communities, producing negative consequences for both patients and healthcare workers, leading to higher associated risks and less than optimal care outcomes. The second annual Health Equity Summit was recently held at UVM to showcase initiatives being developed and implemented across our local and extended communities to dismantle the institutional inequities that can lead to poor health outcomes while improving patient experience and inspiring our communities and advancing health equity. Our guests today are Tiffany Delaney, Director of Office of Diversity, Equity, and Inclusion at UVM's Larner College of Medicine, and Paul Suk-Hyun Yoon, Senior Advisor of Inclusive Excellence, who co-chaired UVM's 2023 Health Equity Summit with Tiffany. Welcome to both of you.
Thank you.
So for many of us, DE&I is a lot about race. Can you tell us a little bit about, but obviously your program is so much more than that. Can you tell me about what equity means to the both of you?
I think for me, equity is the state where everyone has the opportunity to achieve, and we're talking about health equity, the opportunity to achieve their best health outcomes, regardless of their identities, their circumstances, and the like. And so really the summit was really designed to display and showcase sort of some of the work that's been happening across our region to address health inequities across numerous populations.
I think Tiffany put it really well. I think the only thing I wanted to add is that what we're trying to showcase in this Health Equity Summit is equitable outcomes for all people in our state and hopefully all across the world as well, in all of the different ways that might mean.
All right, we talked a lot about equitable outcomes just now. Tiffany, what does that look like for a caregiver? How can a caregiver be culturally humble?
I think that what I always tell folks is that a lot of it starts with the person internally. So when we're talking about DEI, cultural humility development, it's really people kind of understanding who they are, who their identities are, what their experiences are, because that's going to influence the lens through which they see things. And so I think that in order for providers to sort of think about equitable outcomes, it's knowing yourself, getting to know your patients, listening to your patients, continually educating yourself about your patients.
And Paul, a group that a lot of times faces disparities in healthcare is the LGBTQIA population. Can you tell me a little bit about the disparities they face?
Sure, absolutely. Well, first of all, I'm just really glad that we're being asked that question. It's one of the topics that we really intentionally tried to highlight in the Health Equity Summit. I think that it's a list of challenges that really deserves a lot more attention. I think that there's a wide range of challenges that members of the LGBTQIA population face here. Everything from individual interactions that they might have with a medical care provider, to the staff that they interact with when they're just checking in, to, again, lots of other interactions that they might have, whether it's perhaps within the medical school or the nursing school curriculum and not being kind of taught about the issues that face the LGBTQIA community, again, to a whole host of other issues as well. I think some of the things that we're trying to, again, highlight is that there are things that are exacerbated, particularly in a state like ours, in a rural setting. Whether it's access to a provider that kind of understands their issues well, to just even being able to get an appointment right now as well. And then furthermore, I just wanted to highlight how some members of the LGBTQIA community, particularly our queer and trans members of that particular community, those who might have disabilities, and even youth in our state really face very significant challenges in order to get the care that they deserve as well.
Especially with access, because what can happen is that if you have a bad experience going to a healthcare provider, you might put off your care. You might say, okay, I'm not going to go back and do that. And so all folks need to really think about and look at are the outcome data. And that really does sort of illustrate when we're talking about disparities, why one group might have this set of outcomes in terms of their care versus this group having very different outcomes. And that's really what we're trying to address.
Yeah.
Okay, and you had mentioned before neurodiversity as well. So Tiffany, for neurodiverse individuals coming in, what sort of equity issues come up for someone in that situation?
Yeah, I think probably first and foremost is that a lot of times we don't talk about neurodiversity as, a lot of times we think of diversity, we're like, oh, it must be race, ethnicity, perhaps gender, but it's so much broader than that. And neurodiversity, everything from ADHD to folks who may be on the autism spectrum or have autism spectrum disorder, a lot of times the settings in which care is provided was not really set up for those folks. And so we've really, one of the sessions that we did this year was actually run by one of our UVM Larner College of Medicine graduates who runs a practice outside of Plainfield, Vermont for neurodiverse individuals. And it's a system of care that she has set up that is specific to the needs of those populations. So I think that that's actually one of the things that I'm really excited about, because for a while it seemed like, okay, diversity is just about these folks. It's like, no, it's so much broader. And the more we sort of start looking at, again, outcome data for different groups, who is getting care, who is having successful care, all of those things, I think that diversity will broaden in terms of its definition.
And you mentioned settings that are easier for neurodiverse people to use when getting healthcare. Can you describe what that would look like, just like a couple components of it?
Yeah, well, I've seen a couple of different things. I actually have a friend who has a child who is neurodiverse, and going to the doctor's office, bright lights, loud, just there were some aspects of the setting that just were not particularly conducive to the person feeling comfortable. And I've seen different practices where people are starting to address this, where perhaps you do have fewer people in the waiting room, or you turn down the light. There's so many different ways of doing it. And really, I think a lot of it is working with your clients or your patients to see what they need as well. And so having physicians and healthcare providers that know, okay, this is what I know, but I'm actually going, you know what you need or what you think you might need. Let me know that. So then that way they can address those needs.
All right, we've talked a lot about patients. So what are ways that we can support DE&I and our caregivers?
Yeah, that's been a huge discussion at our medical school. Really very much student-driven over the last 15 years that I've been working in the diversity office at the College of Medicine. I think that there is a demand by medical students, not just here in Vermont, but everywhere, where they're seeing a disconnect between what they've been taught or what they're being taught as it relates to providing this care to a diverse group of folks versus what they know from when they either volunteered or did work before they came to medical school. And so now what they're trying to do is sort of synchronize it a little bit more, to have more cultural humility development, looking more at things like social medicine, looking at that data to try to figure out why those disparities exist and why they seem to persist in some instances. I think that it's I know that medicine, nursing, allied health, everyone seems to really be sort of understanding that the way medicine has been practiced over many, many, many years is evolving and needs to evolve to ensure that we are including or being as inclusive as possible for all of the patients we are serving. So whether it's through the curriculum, the way students go out and work with members of our community, there's a whole host of ways that we're working to make sure that our students graduate as culturally humble physicians.
All right, and we talk a lot about of course here healthcare, but nationally or in our state, of course, food and housing insecurity are a really big problem. And that was something that you addressed in your summit as well. Can you talk about how you tried to address that and what that looks like in our healthcare?
I think there were 2 or 3 different sessions that we had that were run by community organizations who have actually been on the ground, understanding that something as fundamental as, do you have a place to live? Do you secure a place to live? Do you have food? Some of those things that are sort of like fundamental in terms of the hierarchy of needs, you have to address those. Those are fundamental to address in some ways before you move on to some of the other things, because you can imagine if you're trying to work with a patient who doesn't have a place to live or can't afford the medication that you're going to give them, then it's a much more fundamental problem that you have to work with. So those basic needs, that's one of the things we're really working on, something called social medicine, where you are addressing those needs, identifying those needs, addressing those needs. And what was nice about, I think, Paul, you agree about the summit, was that we really tried again to showcase is not just the work that's being done around this at the university and at the medical center, but our community partners,
Right.
who many times are on the ground, and they're creating these initiatives, they're launching them, they're studying them to make sure that they're actually having the desired effect. And so I think that that's been really rewarding for me to see. It's like we were really trying to sort of bring the people on the ground together with the folks at the medical center and at the university to sort of say, hey, how can we strengthen these?
Sure.
Absolutely.
And of course, this is equity in healthcare is more than just a Vermont problem, and a lot of that's symptomatic and systematic, of course. So how do we begin dismantling something that's so fundamental or so ingrained, I should say?
Well, I think many of the things that Tiffany has said are helping to start to do that. I think that, as Tiffany's already shared, what we're hoping for is an evolution of the way in which we teach, right, people who are entering into the healthcare profession, and hopefully, right, all of the things that they are then taught will then yield different outcomes for individual patients, of course, but more broadly for communities and for society as well. I think that, again, perhaps it's more of an evolution than a dismantling, because we obviously have patients right now, right here, that we've got to care for as well.
And I think I'll just add to that I think that one of the most important things, or one of the most important takeaways that I've sort of centered in my life, is that diversity is about everyone. It's not just about people of color, people who are LGBTQ, any specific group. It's about all of us. Everyone has a part in this discussion, and everyone has their own unique identity that they bring to healthcare, their interaction with healthcare. And so I think the more that people sort of recognize that DEI and diversity is not just about, those folks over there, or these folks here, it's about all of us. I think that's, when you use the word dismantle, I think that in some ways, the more people recognize that and realize that they quote have skin in the game, so to speak, then that's going to be the way that we're going to be able to sort of move forward and what's the word you use? Not dismantle, but
Kind of evolve and
yeah.
transform, right, the healthcare, profession.
Exactly. Yes, it'll help with that evolution.
Paul and Tiffany, thank you so much for joining me today.
Thank you very much. Thanks for having us.
For more information about the UVM Health Equity Summit, or to learn what UVM MC is doing to raise awareness about issues of health equity, visit the web address on your screen. Thank you to everyone here at WCAX who makes this program possible. We'll see you next time on Across the Fence. Have a good one.